Good evening, everyone. Tonight is January 15th, 2026, and this is the Board of Health for East Long Meadow. Um, the Board of Health is recording. Is anyone else recording? Okay. And tonight, this meeting is held via Zoom webinar pursuant to former Governor Baker's order suspending certain provisions of the open meeting law, which has been extended multiple times. My name is Christine Johnston, Chair of the Board. So our first item on the agenda tonight is to approve the minutes. We actually have two sets of minutes to approve. So the first set of minutes is from our November 19th, 2025 meeting. Does anyone have any additions or corrections to those minutes, or do we have a motion to approve?
I motion to approve as written.
And I second.
All right, and a roll call vote for that. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Sorry about that, Katie. Rebecca Torsha?
Aye.
All right, so the motion to approve the November 19th meeting minutes has passed. Then we also have a second set of minutes on January 7th, 2026. The board held an open hearing. And we also have the minutes from that hearing. Does anyone have any changes, additions, corrections? No? Okay, I can motion to approve the minutes from January 7th, 2026 as written. Do we have a second?
Second.
All right, and roll call vote, Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
Awesome. So those minutes have been approved as well. Do we have anyone here who is for public comment tonight? Now is one opportunity for folks to comment.
If anybody would like to say anything, please raise your hand. Nope, we're good.
All right. So our main item for business at hand tonight is a public hearing to review and hear comments relative to proposed Board of Health regulation of the East Long Meadow Board of Health restricting the sale of tobacco products. So what we will need to do first is hear a motion to open this hearing.
Hearing for public, or what is the word? I just had a brain fart. I motion to open the meeting.
I can second that. And so we are opening the public hearing. Roll call vote, Christine Johnston, Dr. Katie Jobbins.
Aye.
Yep. Rebecca Torsha?
Aye.
Awesome. And so now the public hearing is called to order. So we are very appreciative of your time. Lisa, we're joined here tonight by Lisa Stevens Goodnight. And I will let you introduce yourself, and then we will go through our proposed regulations.
Okay, my name is Lisa Stevens Goodnight. I'm the Director of Tobacco Control for the Massachusetts Municipal Association, which represents the 351 cities and towns across the Commonwealth.
I'm muted. It's 2026, still dealing with the technology. I think we'd be better 6 years in. So what we have is a proposed regulation restricting the sale of tobacco. This has been reviewed in a number of public meetings up to this point. The current regulation, which I know you sent me and I didn't I opened, but then it's not sitting, is dated 2023. So it's a few years old, but there are some pieces of it where definitions data has changed, and some additional pieces to it. So Tammy, I don't know if you would like to take over at this point.
I think that for the most part, I think the most noteworthy of the changes would be the cap on the nicotine pouches. And of course, I'm sitting here not with the right one in front of me. We also wanted to make sure that we've adjusted the number for the number of tobacco permits in town, just to kind of make just to adjust it for closure and retirement of previous tobacco licenses, to include that in there. And then pretty much just adopting the model regulations with the language and the definitions within. I think that's kind of it. It's not a big heavy overhaul, I guess. That's what I'm trying to say.
Lisa, is there anything that you want to add at this point?
Um, no, I can speak a little bit on the oral, since that's the biggest change you guys are making, and speak a little on the oral nicotine pouches. I don't know, they're kind of a new product, so not everybody knows about them or much about them, though you're seeing more and more of them. So this is becoming less true as the days go on, that nobody has heard of them. But they are, for those that don't know, they're small nicotine salts that you put in. They're in a little pouch. You put it between your gum and your lip, and it gives like a kind of a quick hit of nicotine. So I would encourage the board to adopt the oral nicotine pouch provisions in the draft regulations that limit the strength of nicotine pouches that can be sold in East Longmeadow. As I said, they are the fastest growing nicotine product on the market. So according to the CDC, from 2016 to 2023, sales increased from 6 million to 334 million units. They are not just, and that use is not just limited to adult use. From 2019 to 2023 in Massachusetts, use among high school students tripled from 1% to 3.2%. So it's still a small percentage, but it's growing very, very quickly. They can be discreetly used in school because they don't have any smoke or vapor. So they're very easy for students to just kind of like tuck in their lip and you wouldn't know. And the containers look similar to gum or mint containers. So that's another way that they're just very hard for, for people to notice that youth are using them. Currently, 480,000 middle and high school students are using them nationwide. And they're the second most popular nicotine product used by youth in 2024 after e-cigarettes, which still remain the top product among youth. Then there's also some sense that the nicotine pouches are safer or healthier way to quit smoking or vaping. They are not an approved cessation device, so they can't advertise that they are used to quit, but that there's like this sense that they can. And there's some online influencers that have talked about how they can be used to reduce your nicotine intake. But the truth is that just because they're smoke free doesn't mean that they are nicotine free. They still contain nicotine, which is still very addictive and has negative impacts on people's health. Again, they aren't an improved smoking device or quitting device. And the FDA actually specifically prohibits the companies from making claims that the products can help people quit nicotine. So they are not allowed to or supposed to be saying that kind of in their commercial product or commercial messaging. And then although we have right now, because they're so new to the market, we have really limited data on the health impacts, but there's some early signs that they can have some serious health consequences. For example, dentists report an increase in mouth lesions, gum problems, which can be linked long-term to some pretty serious cancers. So that's not to say that we know that they will cause those cancers, but we have some early signs that there's reasons to be concerned. And I personally would like to not get the data that says that they killed a ton of people down the line because we didn't do something about it when we could have. So we've also seen really high nicotine content, so as high as 28 milligrams per pouch on the market, which is close to like a pack of cigarettes per tiny little pouch, not per container, per tiny little pouch. So those are kind of the reasons why I think it would be a really positive step to limit the strength that these can be sold in. And I would also recommend just keeping an eye on the product in general going forward. Because again, the last thing I want is to have to, 10 years down the line, be reading a bunch of data about how people died from these products.
And Lisa, I think it's really important, like you just said, around the amount of nicotine per actual pouch.
Mhm.
So maybe you can just explain so people understand if they watch this or hear. In one pouch, so say it's a 6 milligram pouch.
Mhm.
How much is that? Like, what equivalent is that to a cigarette? Like the systemic amount of nicotine you're getting.
So a cigarette, I'm trying like the numbers of it. It's a cigarette has like 12 milligrams of nicotine, but of that you get around 6 to 9 maximum actually get into the user's body, and then some of it obviously there's the external like secondhand smoke that other people can inhale. So my understanding, and again, this we don't have a ton of science on this yet, and as we get more, like I'm updating everything as quickly as I can. But it looks like almost all of them. People keep it in their mouth till they're not getting a kind of a buzz anymore, and then they throw them out. So I I guess you could put it in for like a minute and not absorb all the nicotine, but that isn't generally how they're used. People are generally absorbing all the nicotine in the product. And they come in packs of 15. So if it's 6 milligrams, the other thing that we see is a lot of people use like two at a time. So like they will use two of the 6 milligrams and then they'll be getting 12 milligrams of nicotine in their system.
Well,
And
sorry. So what I meant, I was giving you a leading question, but I'll answer it. So in one cigarette, it's 12 milligrams, like you said, but systemically you get around like 1.2 to 1.8 milligrams. And so if you're getting 6 milligrams, and like you said, they're getting the full 6 milligrams, that's actually the equivalent of having essentially six
yes,
cigarettes in your body. So one pouch is actually a much higher hit of the nicotine, which is
yes.
why limiting, that's why I think we all were very adamant about limiting it on that 6 milligram, because anything above that is dramatically higher. Whereas if you read like the label of one of these containers, it says a certain amount of time you should leave it in for, but like you said, people are leaving it in much longer. So theoretically, a 3 milligram should be about the equivalent of one cigarette. So that's kind of what people, the way it's
Mhm.
advertised. So I think it's really important for people to understand anything higher than that is a much higher level of nicotine that's actually going into your body.
Yes. And the other thing is that if you look at the nicotine amounts for, because there have been comparisons made to cessation, again, I want to emphasize these are not cessation devices, but there has been some comparison, not directly by the industry, but by people who are kind of like selling the products online as influencers that these could be used as reduced risk or cessation devices. Nicotine gum, which also has nicotine, comes in 2 milligrams and 4 milligrams, and is designed so that it delivers that over an extended period of time. So that's kind of why we like one of the reasons that we looked to the six, because then comes in 3 and 6, and so it would be kind of the close. I mean, they're not cessation devices, so like they don't have to adhere to that, but that is like as kind of the closest equivalent we could say that was like we know nicotine gum is safe in the sense that it's not like deadly to chew a piece of Nicorette gum. Um, but yeah, these like 28 milligram pouches, that's like smoking like three packs of cigarettes in terms of the amount of nicotine getting into someone's body. Um, and that's just in like a sitting.
Do we know how many towns have already passed these regulations? Similar ones?
So I was looking at the list I have, and it is out of date because I was looking at it right before, and I was going to send it to you guys, but I can send it later. It's just a bunch of towns passed this right at the end of the year, and so there's at least like 4 towns I have that are missing from the list, and so I have to go through my records and make sure I didn't miss any others. Um, as of like November last year, we had 4 that had passed it, had passed this, and then an additional 6 that had restricted them to adult onlys, and 1 that had banned them completely, for a total of 10 that had, wait, no, sorry, 11 that had um, done something to restrict the sale of oral nicotine pouches.
And from my understanding, these are so new that in our 23 regulations, we don't even address nicotine pouches. And I'm sure that many towns haven't even looked at their tobacco regulations longer than it's been for us as well. So are having
Yeah.
some discussions.
Yeah, and we had to do a lot of education because, again, like in 2023, like we knew the products were on the market, but they just weren't that big. In 2020, I believe, Philip Morris bought Zyn for $16 billion from Swedish Match. Um, and they increased production and they increased advertising. So we've seen this huge growth really backed by this major tobacco company, pushing these products as one of their top growth products.
Well, and I think it's really important that we talk about the fact that it's actually nicotine, right? So that's a highly addictive substance. We
Mhm.
know the complications from the medical profession of what it does for increasing your heart rate, risk of hypertension, risk of increased heart disease, and increasing your risk of stroke. And that's just from the nicotine component. So I think that's really important to talk about, like you said, limiting it, so where we take it down to the 6 is where we obviously talked about and what we put into our new
Mhm.
regulations. And that also understanding that it's not well studied, but we do have a lot of data around nicotine, which is really important, and especially the addictive potential, especially in young individuals, is very high. So now, Tammy, is there anything else we need to review in addition to the pouches on the regulation, or was it? I think that was one of the big changes we made, right?
Yeah. Can I just point out that
Yeah.
we're not at this point, just for anybody who's watching or watches later, we're not restricting the sale of, or the proposed regulations do not propose to restrict the sale of these products. They just propose to restrict the sale of the products above 6 milligrams per
Mhm.
pouch. So for folks who are, this is their preferred method, they're of age, right? We're still able to access that product, things like that, right? For businesses, they are still able to sell those products, things like that. We're really just looking at restricting the amount of nicotine in each particular patch that can be sold. Sorry, I didn't want to cut you off there, Tammy, but I just want to be really clear about what the proposed regulation outlines, that it's not a complete ban. I know, Lisa, you said that there's one community who's done that, and that's not what we're looking for here.
Yes, there's one that did that. I mean, one of the reasons that we like that the model regulations have the way it is because we do want to leave open room that these could potentially be, the data could come back and these could be cessation. But that would be, I think, if they did have, if there was a possibility for them to be used for cessation, it would definitely be in those lower nicotine amounts. It would not be in the higher nicotine amounts. So, um, we want to, again, we have to react as we get the data and try to be proactive, but realistic.
So that question that Katie asked, the only other one that I picked out, the 2023 regulations had our number of permits listed at 14. And since 23, one business no longer has a permit, and therefore it would just drop that number down to 13 because of the decreasing cap. Tammy, anything else?
Is it 13 or is it 12? I feel like there was we had lost one by the time we put the oh my gosh. We lost one by the time that we voted it in, so the number wasn't correct.
It's 13 in the regulation.
Then that's right.
Yeah.
Okay. But everything else is pretty much straightforward from what the model regulation is, which follows along very well with our last one. There was a few issues with the way the layout of the last one too. There was some duplication, so this corrects those duplications. That's it.
Katie, Rebecca, any other additional questions or comments on this?
None for me.
Very clear.
Okay. Now at this point, is there anybody here for public comment who would like to speak on the proposed regulations?
There's no indication.
Okay. If there's no one here to speak on or wishes to make public comment, are you ladies ready to move to a vote? Okay, so I can make this motion if you want. I would motion to And Tammy, we are recommending because the regulations are actually, or does this then go to the town council?
No, this is a Board of Health regulation.
Okay, so then therefore the motion would be to adopt the proposed Town of East Long Meadow regulation restricting the sale of tobacco products as written and presented this evening. Do I need more than that?
Do you need a date of when it's going to start? Lisa, do you have a suggestion on a time frame for the businesses getting these products off the shelves?
Thanks, Alex.
I guess I don't know your town well enough to know kind of what kind of volume goes through. Tammy would probably have a better idea. But yeah, usually giving it a sell down date so that they can get rid of the product that they've already purchased is good. I mean, I've seen anything from like a month to a year. I doubt they would take a year for them to sell down their product, but that's usually if it's like a bigger, like they have to remove all e-cigarettes or something that would, which is not recommended here. I'm just saying, give as an example. Then you would obviously give a much longer period of time. But yeah, Tammy
I would
probably has
say
a
like
better
maybe
idea of.
March 1st would be, because that's like a month and a half. Alex, is that, you know, the product volume?
Oh, March 1st? Yeah, that
Yeah.
should be good. I think that's enough time to make sure that everyone gets the regulations and understands. Not all of our tobacco stores even sell pouches.
Right.
So Alex, and I mean, you're the one who's out on the road, right? That would give them now 2 weeks till the end of March and then a full another month. I mean, till the end of January and then the full month of February to have that sell down period.
Yeah, and I also think that's enough time to pass along information to the Tobacco Control Coalition so that they're aware of the changes. Yep.
Okay. All right. So I am going to make a new motion. The motion would be to adopt the Town of East Long Meadow regulations restricting the sale of tobacco products as presented this evening with an effective date of March 1st, 2026.
Second.
All right. And so we will do a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Hi.
Right. So that motion has passed. And at this point, do we have a motion to close the hearing?
I motion to close the hearing.
I can second. And roll call vote. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
All right. So the public hearing is closed. Lisa, thank you so much for your time tonight. We really appreciate it. Feel free to stick around or go enjoy your evening. The rest of our meeting agenda is health department updates and business. So Tammy, I'm gonna pass that over to you, hear what's going on in the health department, and Alex if that's needed.
And I kept it slim because I wasn't sure how long we were going to go tonight. I feel like it's been a real busy couple of weeks. I think maybe it's all relative. Like we take a little time off for the holidays and then we come back and it feels a lot busier, but I think it's been pretty busy. We are now in budget prep for next fiscal year. Our level 1 budgets are due tomorrow. So that's been keeping everybody busy. I'm happy to say that we've been able to keep our operating budgets pretty level and our trash budget. Actually, I was really excited that we were only going up 1% on our trash budget this year. And let's see, some other things. Liz is always great and gives me the rundown of what's been going on for the year. And so she just kind of gave me some trash numbers today for the year. We have recycled 548 tons of containers this year and 729 tons of paper. We recycled 43,739 pounds of textiles through Heart Springs and CMRK. Let's see. I know in there we've collected over 18,791 pounds of books with Bay State Books. We do we do it in conjunction with the library, and we also have a book kiosk outside of the senior center. So if people want to get rid of books, they don't have to be like super great condition, kind of similar to the textiles. Bring the books there. They'll either get
Wait, tell me more about this. I have many books.
oh
I
there's
didn't even know about this.
yeah, you can go behind the senior center, and there is a book kiosk,
And
and
you
then
just pop them in?
you pop them in. I know there's a program with the library, with but you'd have to contact with them. But any books like that they put out of commission as well, we recycle in another container somewhere else. A super secret location. No, it's not super secret. You can see it. It's right side of the, but it's not for the public to use. Yes, so we have that container there, and then we have the obviously the textile one behind the senior center or behind the fire station. And then the once a month we have Heart Springs come and do the big event. And this year we diverted 58,287 pounds of food waste. And that is kind of something that I think over the next year we're going to look a little harder into looking to see if we can pilot some residential food waste collection or composting programs. Ooh. And this week we also set the date for Earth Day, which is going to be May 2nd with I think we're gonna try to reprise the Earth Day fair the day before. So more information to come on that. Let's see. Oh, I had another little note in here. Nurse Chris wanted just to let us know that she's seeing a bunch of flu still in Maven in our database in town. A little bit of COVID, but and not too much else is pinging on that. We
Flu is everywhere. COVID
flu
is
is
everywhere.
everywhere. Everybody's getting it. Not too
So
late.
I was in the hospital, and more than half of my list when I was rounding was flu.
Half, more than half. How many people would you say that is?
Well, again, I was on the floor where that could happen. So on my team normally ranges between 16 or 18 people. So, and then nope, multiple people had flu and COVID together. I've never seen that before
Flu and COVID.
at the same time. They didn't feel good.
Oh, I can't
And
imagine.
so, but I think the thing that's really important is that and this was on the news, Bay State elevated their respiratory risk to everyone now we're masking again in patient care areas. So I think the risk right now for the flu is very high, and we across the entire country, because of I'm just going to say it, misinformation, people are not getting vaccines. And so we across the entire country we saw a dip in everyone getting vaccinations this year. So it's very important just to recognize that elderly, those who are immunocompromised, um, are higher risk. Patients are unfortunately going to be exposed to more things.
Anything else you're seeing
It is
outside?
not too late to get a flu vaccine.
No, please get it. Get it all.
And even if you've had the flu, the recommendation is to still get a flu vaccine because there are multiple strains and
Yep.
we could get another wave later in the year.
Well, we still saw, and I don't know if you were seeing this, Rebecca or Christine, in your spaces either, but we had a couple unfortunate noroviruses still lingering with like the GI bug. There's been a lot of strep throat as well too, which I'm like, ugh. And then obviously non-COVID, non-flu, upper respiratory like human metapneumovirus, and then para-influenza as well too.
A lot of fun stuff going around.
So lots of good hand hygiene. If you are sick and have a fever, stay home. Don't take Tylenol. Don't give your kid Tylenol so they can go to school. If you can keep them home, keep them home.
Or Advil or any other fever reducing medications. We're not calling out any brand by name, right? If you're
Any
sick, stay
medication that
home.
lowers it. Yeah.
I know we all wanted them to go back to school after the holidays, but Let's see. Chris also wanted to let everybody know that she just started teaching a new Pilates class over the senior center. I think it's just started on Tuesday. And also we have a new senior center director, Emily Constantino. And I don't know the name yet of our new outreach coordinator that starts in February, but I know that the health department, once that they are in place, we will put that person to work. Um, Alex does not, it doesn't seem to slow down the number of calls we get for housing situations and for people in distress in housing situations. And it's always been great to have the previous outreach coordinator. So it's kind of bridges that gap between kind of seniors and our department and the health department. It ends up being a good relationship. And I think more towns should have that. I've never worked in a town that did that so well. So I'm very kudos to the way that it's set up here. Just trying to think. It's beginning of the year. We are looking to do another food safety manager course for our food service establishments. That information will go out once we get a date and a place. I confirmed that the person who did it last year wants to do it again. We just need to get a good venue. And let's see. Alex or Renee, anything you want to throw in? Plug. Oh. Trying to think of, let's see. It's the beginning of the year. We're kind of starting over with new permits and everything like that. So it's nothing super exciting, but
Oh
just
yeah, I
enough.
got my census in the mail today for my dog's
Mhm.
licenses. I have to renew those too.
Got
Very.
mine today too. So make
And I
sure
have
you
a
renew
new
my
dog,
dog.
so I have to do that now. Who's sleeping? You guys want to see my puppy? Here she is.
Oh.
She's sleepy.
And we have also been working alongside the clerk's department to make sure that that this year in June, Ollie's Law went into effect, and it's an act to regulate the safety of dogs, basically when they're not with their owners. So that would be things like boarding and daycare. And so we've been learning a lot in the process along the way of what is considered a kennel and what is not considered a kennel, and trying to make sure that the health department doesn't, we don't license the kennels, but through the animal control office, which is part of the health department, we inspect the kennels, and then we have to report on them once a year to the state to make sure that they've been inspected, that they've been applying. So that's and kind of an ever changing. I feel like we keep learning a little bit more about the program as it goes along. The law is in place, but a set of regulations haven't been established yet. So we're kind of waiting for that. I've talked to a lot of people at MDAR and hopefully Massachusetts Department of Agricultural Resources, who regulate animal control. And hopefully in the next 6 months or so, we'll be seeing regulations to kind of help support what we're starting to work on. And that's been, I feel like we call this animal control year. It was very quiet until we hired a new animal control officer, which is very great because we have an extra animal control officer. It was almost like the universe knew. They sent her to us. And she'll be doing the academy hopefully in a month or two, which will be great. So then she'll be Massachusetts certified. And we'll have a full complement. And I think that's kind of all for the fun and exciting things at the health department this January. I say fun, other people don't think it is, but When people stop by, you'll hear laughter when you open the door.
Anyone have anything else to discuss? New business this evening? All right. Hearing none, should we look at a meeting date?
I think
And
I think we should definitely meet in February.
yes,
So I was gonna say we have to meet before the end of February, right? Because of the extension of the meeting we had last week.
Yeah.
if that is determined to be the case, then yes. And that was
'Cause it expires February 28th, right?
6.
26, I think.
26th, February 26th. I couldn't remember. Okay.
Yeah. The 26th.
Okay.
Is that a good date for everybody?
I'm pulling my calendar up. My apologies for not doing this beforehand. No, that is not a good day to have a major work event that night.
You want to do the 25th or the 23rd?
I can look and see. I can ask them if
Because the
They're
week before is
open.
February vacation, so I feel like that would be a horrible week.
We're out.
um 23rd or the 20th. Oh, I said the 23rd probably wouldn't be good because we want to make sure that we give enough if our offices aren't staffed on Friday or Thursday, depending on whether or not people are on vacation. We won't be able
Right,
to post it
okay.
in time.
So then the 25th, because how
25th?
many,
Does
how
that
many when do we have to post it? Like, is it 2 weeks
Monday?
before? Oh, just
No,
Monday. Okay, yeah.
it's 48 hours.
Yeah,
It's just
so then
it's
the
just 48 hours.
25th?
Okay.
Okay, let me
Let's put it
find
on
out.
tentatively.
I know that I believe not which one. Planning Commission might do Wednesdays. But I will ask and we can tentatively pencil in the 25th.
Okay,
Katie, what does your night of the 25th look like? Because depending on how long that agenda is, if we needed to work around that planning commission meeting, either be a little earlier or a little later, I just want to be respectful of
I'm
folks'
I'm
evenings.
free from 5 until 8 p.m.
Rebecca?
Okay, that works. Mhm.
Yeah, I'm free as well. So Tammy, if we need to work around a planning commission meeting,
Okay.
if the date works for everybody, including the health department staff, those are 2 very busy weeks for me that week prior with vacation and then that week. So if that week works for everybody and we have to go a little later or something, I'd rather do
Same.
that than earlier, a little bit later than try to find a different date.
Mhm.
Yeah, and I'm out of town the week before, so I'm not able to do the week before.
Me too.
Right. Well, I will so 5 to 8 is the window for that day. I will get back to you guys and make sure that we can see if we can secure something.
That would be great. Thank you.
Thank you.
Awesome.
Right. If there is no further business, I will make a motion to adjourn this meeting.
I second that.
I vote yes.
All right. Christine Johnston, aye. Katie Dobbins,
Aye.
Rebecca Torja.
Aye.
All right. And Renee's cat, also aye. Yes. So meeting adjourned. Everybody have a great week, a great evening. Stay healthy.
Take
You
care.
too.
Thank you, everybody.
Bye-bye
Bye.
now. Take care.